Inhaled medication is most commonly given through the mouth using an inhaler with a spacer, or a nebulizer, but also includes nasal sprays and nose drops. There are many different types of inhalers, including metered dose inhalers and dry powder inhalers. Most often, inhalers are used by older children who can tell you how they work, but always be sure to review the package insert and medication information so you know the right way for the child to use it. Here are some additional principles to follow when using inhalers. Some inhalers come with a cap, so remove it, and then check the mouthpiece for foreign objects before using. Have the child breathe according to the package instructions. If the child gets 2 or more puffs, make sure you know how long to wait before giving another puff. Some children will want to take the medication quickly and won't use the right breathing techniques, so always watch the child while he takes the medication and have them wait the instructed amount of time before taking another puff. Most metered dose inhalers are only good for a certain number of puffs and come with a counter. Be sure to check the counter every time you administer a metered dose inhaler so you'll know when it needs to be replaced. If an inhaler is not used correctly, much of the medicine may not end up in the lungs. Using a spacer can help. A spacer is used to help the child get the full dose of medication by holding it in the chamber long enough so the child can breathe it in with multiple breaths. Follow the instructions for giving medication using the inhaler with spacer, since all spacers are slightly different. And be sure to have the parent or healthcare provider show you how to use the child's inhaler with the spacer. Some children may have a hard time using an inhaler correctly, so they get inhaled medication using a nebulizer machine. A nebulizer machine forces air through a solution of medication to create a medicated mist. The child then uses a face mask or mouthpiece to breathe in the mist. Using a nebulizer machine is not difficult, but it does take practice to learn how to put the parts together. Have the child's parent demonstrate how to assemble it. All nebulizer machines come with directions. Read them carefully before using. Here are some general guidelines you will use regardless of the type of machine. Check to make sure you have all of the nebulizer parts. Turn on the machine to make sure it works. Most medication used in a nebulizer comes in a single dose vial. Sometimes you may be required to administer 2 medications through the nebulizer. If this is the case, be sure to check the written medication consent form or individual healthcare plan for instructions regarding combining medications. Watch the child during the entire treatment to make sure he gets all the medication. Many parents will supply a nebulizer machine to be used by their child. The nebulizer should be labeled with the child's first and last names and should only be used by that child. But your program may have a nebulizer machine that is not labeled for a specific child. 2 or more children can share the machine if it is not labeled for single use only. However, each child must have his own tubing, medicine cup, and mouthpiece or face mask that is kept in a separate labeled bag. Whether you've given medication by inhaler or nebulizer, it's important to follow the manufacturer's instructions for keeping them clean after each use. This prevents the spread of germs or giving a wrong dose due to the buildup of medication. And remember, never put the metered dose inhaler canister in water. Medication can also be breathed into the body through the nose. Nasal medication comes in drops and spray. Because most children find the sensation unpleasant, giving nasal medication can be challenging. So keep the age of the child in mind and try to make the experience as easy as you can. In addition to the instructions, follow these principles to give inhaled nasal medication. It's a good idea to have the child blow his nose or wipe away any visible mucus. Let the child know he may taste the drops or spray. Positioning the child's head properly helps make sure he gets the medication correctly. So tilt his head back slightly. Unless otherwise instructed, gently push up on the tip of the child's nose so you can see the nostrils and put the dropper or sprayer tip just a little into the nose. It's best to have an infant lie down to administer nose drops. Don't forget to plug the other nostril as you give the dose so the child can breathe in the medication correctly. And remember, to avoid contamination, wipe off the dropper or sprayer tip after giving the dose. Your instructor will give you an opportunity to practice giving inhaled medication. Medication can be given into the eye using drops or ointment. In addition to the instructions, follow these principles when putting medication into the eye. It's easy to be confused when giving medication to only one eye, so be sure you're applying it in the correct eye. To do this, remember that if the child is facing you, the eye that is on your left side is actually the child's right eye. So be sure you know which eye is the correct eye. Clean the child's eye with a clean tissue, wiping from the inner corner to the outer edge. Position the child for comfort. Older children can usually sit for eye drop medication, but you may find it easier to have a young child lie down. With one hand, make a pocket in the child's lower eyelid. Using the other hand, put the medication in the child's eye. Very often, children blink when getting eye drops. If the drop completely misses his eye, you can give the dose again. If any amount gets into the eye, don't give another dose. If giving an ointment, start from the inner part of the eye, which is closest to the child's nose, and go out. Children will often experience blurry vision right after eye ointment is applied. Let the child know this is normal. You'll also need to know how to give medication in the ear. Ear medication usually comes in drops. If the outer part of the child's ear has some crusting or earwax, you should gently remove this with a single-use towel. Remember, never put anything directly into the child's ear canal. Many ear drops are kept in the refrigerator, so be sure to warm any cold medication by rolling the bottle between the palms of your hands. This is important because the cold drops may cause the child more pain when they enter the ear canal. When you're ready to give the drops, you'll need to straighten the child's ear canal. Because the structure of a young child's ear is different from an older child's, for children under 3, gently pull the child's earlobe down and back. For children over 3, gently pull the child's upper ear up and back. Place the drops so they will roll into the ear along the side of the ear canal. Be careful to not drop directly into the ear, as this can be painful and cause the child to experience nausea or dizziness. Your trainer will give you an opportunity to practice giving eye and ear medication.